Right now it is time for our series that we have put together with the Foundation for Community Health. And that series is we get in touch through the Foundation for Community Health with different nonprofit agencies in our tri-state area where the Foundation for Community Health lends a hand. And when I say lends a hand, that's exactly what they do. They don't implement the program. They don't run the program. Somebody comes to them with a great idea, and they help fund and get the program off the ground and started. And this morning, our guest this morning is John Simoncelli, who is the Executive Director of Greenwoods Counseling and Referrals in Litchfield. John, good morning. Happy holidays to you.
Good morning. Thanks for having me.
Let's talk a little bit about, for people that aren't aware of what Greenwoods is and what you do, let's talk a little bit about the center itself in a general term.
Sure. Well, we're located in St. Michael's Church in Litchfield, and the admin office is behind the church. And Greenwoods started in the early 90s, and it was really born out of a need of individuals seeking mental health care and not knowing where to go. And so the pastor there, David Dobbins, who had a background in mental health, noticed that many of his parishioners were coming to him with mental health issues, with depression, anxiety, some addiction issues, and he really didn't know where to send them. And so he put together a small network of providers in the community who he could refer his parishioners to. And over time, that turned into a nonprofit organization that formally did mental health assessments and referred out to those providers, and then also raised money to help individuals who couldn't pay for their treatment. Because just like in today's world, there are lots of folks in Litchfield County who maybe have insurance, but they're very underinsured. They've got those high deductible plans or those high copays, and they just can't afford to see a clinician every week. And so we still do that today, 30 years later, help pay for individual counseling sessions for individuals who meet our financial aid requirements. And so that's really where it was born about 30 years ago out of that need. That's still our core mission, although our services have expanded quite a bit. So we still do mental health assessments and help connect people with the providers that can help and offer that financial aid. But now we have other programs as well that try to meet the needs of the community.
It's interesting because I'm looking at your website. If you folks want more information, Greenwoods the page I'm on is Greenwood Referrals. But what's interesting is that mental health was the core founding of what you did and what you do. But then again, I look at this and all these things that you do are associated with mental health. They're by different names, but everything from divorce, parenting, eating disorders, family problems, school problems, special issues for either the young or the elderly. I mean, these are all part of a problem which probably stem basically or affect your mental health. And I think when I look at what's going on in our country nowadays, there's so many people that don't understand that mental health is not something that is a bad or a slight to somebody. It's just like any other disease that has to be treated.
Yeah, I couldn't agree more. I'm so glad you brought that up because it should be something that we talk about just as easily as when we talk about our physical health, right? Our need for an annual physical or making sure we check our blood pressure or whatever it may be. Mental health is the same thing. We need to talk about it in those terms. And I think that, over the last couple of years, people are finally starting to realize that if we don't, pay attention to our mental health just as much as we pay attention to our physical health, then unfortunately we're gonna suffer some consequences around that. Anxiety, depression, those things are to your point, are very common, and it doesn't mean that there's anything "quote unquote" wrong with you. It's not some kind of failing if you're struggling with depression or anxiety or even an addiction or something like that. It's something that is common and needs to be treated, and if you do get treatment, it can get better. And I think that's an important message to just kind of repeat and send to all the folks in our community.
Once again, we're speaking with John Simoncelli. I think that it's even more important now than ever because I do believe with cable and 24-hour news networks and with social media and 24 hours of pounding the drum, there is so much information, either positive or negative information, that is fed to humans nowadays that I would think that mental health crisis is even worse than it used to be, simply because there's just no break from the pressures that come to us.
Yeah, that's absolutely right. I mean, I think that's again, that's one of the things that we've seen over the last couple of years is that because there's that kind of constant bombardment of stimuli, like you're saying, constant news cycle, stuff going on with the pandemic and, some social unrest and all of that, even folks who never experienced anxiety in the past are starting to experience it now. Folks who have never been, depressed, feeling some depression. And you're right. Sometimes seeing a clinician, and that's the other thing about our services, is that there's no cookie cutter approach to helping someone. Sometimes it can be, yes, the last couple of years have been really stressful. Let us help you develop some better ways of coping. Other situations can be, the last few years have brought on or triggered some things that occurred or have stayed with you from years ago. Let's work on that. Maybe that's a longer engagement, right? But the first step is picking up that phone and giving us a call so that we can do an assessment and then help connect you with the right service, right? And that's really the benefit of the benefit to clients for what we do, right? Is that it can be super challenging, especially in Litchfield County where we don't have enough providers, to find someone who will meet your clinical needs, who might be in your area, who takes your insurance, all of that kind of stuff. And that's the work we do for people, right? We match them on all those different things. So, I think that can be overwhelming for folks. All right, I know I'm not feeling too good, but, what do I do? How do I find someone? Give us a call. We do that work for you.
Now, how was your association with the Foundation for Community Health put together?
Well, I think that, the Foundation for Community Health is great just because in the way, the kind of simple way that you put it at the beginning of the interview, which is, you can come to the foundation with an idea and say, what do you think? And is there potential funding for this idea? We see this need and we want to address it, but we need some help in doing that. And they're great in engaging in those conversations about how we do that and what the potential funding opportunities are. And so, the last 5 years at Greenwoods has seen a tremendous amount of growth. We used to have about 4 employees, and now we just hired our 19th. We have a lot more folks working for us. There's a lot more need in the community, and we're providing more service. We have a community outreach and recovery navigation team now for folks struggling with addiction, trying to reach those folks in the rural areas who are struggling with addiction. We have a school-based mental health program now with a couple of schools where we bring the service into the school, trying to reduce those barriers to care. So it's those types of programs where we come and we say, listen, we're seeing this need in the community. We want to do something about it. We need either some startup capital or we need some support in this area. And they help provide that for us. And that's really the value is that flexibility with the foundation, which I so appreciate.
We're talking about Greenwoods, counseling and referrals. And John, a little bit about you. I mean, I see that you're a licensed clinical social worker and also an alcohol and drug counselor. What got you into this field? Is this something that you went into immediately, or what you went to school for and what you trained for, or did you gradually adapt into it?
It's basically what I've always done. As a young person, I struggled with depression. I struggled with addiction myself. I've been in recovery for a long time, and because of my experience, I was obviously very interested in it and wanted to help others. And so I went to school for, as you said, social work and also a degree in public administration. Started working with folks who were struggling with addiction and folks struggling with trauma. Those things are often inherently connected. People who are traumatized often develop addictions. And so started doing that direct work and slowly over time moved into more of an administrative role. And then about 5 years ago, I was recruited to work at Greenwoods, and it's been a wonderful experience to really be able to meet the needs of the community and watch our organization grow with the help of places like the Foundation for Community Health.
It's interesting to note that even though you're an administrator there, you're still keeping your hands in action. You're keeping you still carry a small caseload along with your administrative duties.
Yeah, absolutely. I think it's important. It's really important to stay connected to the folks that we're trying to help, right? Because needs change over time. You don't want to lose your connection with the actual individuals who are coming to us for help. So I think it's really important to just stay it helps us stay grounded to the actual work that we're doing, because it's hard work. This is, unfortunately, mental health care in the United States is grossly underfunded. We're not even coming close to the amount of funding we need to address this issue. And so it's hard work to not only, sustain our organization, but also grow it to try and meet those demands. And so I think staying connected to the folks that we're trying to help just gives you that extra little push to keep doing the work.
Well, John, thanks for taking a few minutes and joining us today. If people want more information, is there a telephone number they can call?
Absolutely, yes. So 860-567-4437 is our main number. And you can speak with Ashley or Sarah, who pick up the phones there, 860-567-4437. And then you can always find us online at greenwoodsreferrals.org. And there's a contact page there as well, which you can send us a message through our website. So we welcome any and all calls, and even if it's just information gathering, you're more than welcome to call.
John, thanks for joining us this morning.
Thanks so much for the time. I appreciate it.
All right, take care. Once again, our Foundation for Community Health feature this morning on Greenwoods. Foundation for Community Health gives us all this information so we can give it to you, and you can see exactly what the foundation does in our area and what the different agencies they work with do, and how important that mixture of the foundation is in the average daily life of just about everybody in our area.